folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we have 7 exercises to kill chronic foot, knee, and hip pain.
Bob, 7. The number 7's complete. It's always nice to have 7 answers for something. So
and if you want your life to be complete, make sure you take the second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go to the Facebook and like us, Bob and Brad, because if you like us, we're going to send some positive vibes your way.
There you
it's
go.
Gonna make your day.
Good segue, Bob. It was smooth.
Thanks. Appreciate that.
Unrehearsed as well.
All right, so what are we doing, Brad, to help?
Well, Bob, as you know, chronic pain that's been lingering on for, oftentimes for years,
Right.
in the ankle, knee, and hip, and that's what therapists deal with a lot. Sometimes OT gets the upper, the hands and the arms.
Occupational therapy.
Yep. So anyways, I wanted to dedicate this to from the hips down. So we got 3 major joints, all weight-bearing joints that can oftentimes become, once they get irritated, because you walk on it,
it stays irritated.
Right.
It's hard to calm them
right.
down.
So, and by the time you get after it, sometimes it's not too late, but it's like, how do you deal with it? So that's
Right.
what we're going to show you here. We're going to start out with the ankle, then we're going to go to the knee and go to the hip.
So really the same philosophy that we're applying to each joint is going to carry over, right?
Right.
I mean, we're looking at restrictions,
range of motion, and loss of range of motion, because when a joint starts to hurt, you don't use it as much, it's just natural, and then you start losing range of motion.
And then it hurts even more.
Right.
Because it's not, you're wearing it out in a shorter range.
Right. It compounds.
Yeah.
And oftentimes, if you can regain that range of motion,
you can knock the pain down.
Right. So that's what we're going to go through. First, we're going to show you how to assess the joint, the ankle, the knee, and the hip, and then how to treat it.
Well, let's start with the ankle, Brad.
The ankle. Did I mention that?
Yeah.
Liz, did I say the ankle?
Yeah.
Okay.
I said let's start off with the ankle.
We concur.
Okay.
All right, here we go. So the ankle, can you come down here, Liz? I'm going to, first of all, let's say your right ankle is more painful than your left. And I bet you if that's the case, and you put your ankles together like this, and you pull them both up this way and down this way, you may find that one goes up this far and the other one is restricted in range of motion.
Yeah.
Almost always that is the painful side or the more painful side.
Correct.
So if we can get this ankle to come up to here, where the other one is, the less painful, more than likely the pain is going to reduce. Now, you're not going to do this in one treatment session.
No.
This is going to take a period of days or oftentimes weeks of constant stretching, but we're going to show you the stretches. There's a lot of ways to do this, but I'm going to show you the 2 ways that are probably the most effective for many people.
Fastest and easiest.
Yep, precisely. So why don't you come over this way. See you, Bob.
All right, see you later, Brad.
It's all me. Okay. Let's say my left ankle is the one that's restricted in dorsiflexion or pulling up. I'm going to use the wall, and this is nothing more than the wall stretch. So the key on this is instead of having my toe this way, it should be pointed directly towards the wall. And you may start here depending on how tight your ankle is, and then you just lean forward. This foot here is not getting stretched. It's just there for balance. And I'm going to gently lean forward.
But he's trying to keep the heel on the ground, by the way.
Yep, yeah.
He's not allowing it to come up.
Good point, Bob. Thank you. So that, you're going to keep it down. And you can also keep the knee straight and bend it slightly and get a little different stretch on the muscles, the soleus versus the gastroc. You don't need to know that, but that's what's happening.
So we recommend you doing it both ways, both
Right.
with the knee straight and the knee bend.
Yep. I'm going to say do, 5 to 10 of these stretches, depending on how it feels, and just go pressure on, pressure off.
I would even go so far to say, Brad, that if you're having pain there, you might do this throughout the day.
Sure.
You know,
Right. Yep.
I
would start out at 3 times a day.
Sure.
Unless it flared up really bad because you hadn't stretched it before and it needs a break for the next day.
Every time you go by the wall, just give it a little stretch.
Exactly. That's the wall stretch. We got a lot of walls. Now, the incline board is more aggressive, but when you get to the point, it's really nice. It's probably the best way to stretch your ankle, in my opinion. What do you say, Bob? You concur?
I agree. I concur.
He concurs. Now, you can buy one of these. We have one of our favorite products, or, you can make one. We actually have a video. Just Google Bob and Brad incline board, and if you're handy, you got some tools, you can make one for next to nothing. If you got a few scrap pieces. Now this one, put your foot on there and just put some weight gently on there. It's nice to have something to hold on to, a wall or furniture. And again, stretching it the same way. Pressure on, pressure off. You can bend the knee, pressure on, pressure off. If you did like 5 of them with a straight knee, 5 of them with your knee bent, that would clear everything. So
now I'm going to add to this, Brad, too. In order to help you with the stretch and actually to help you with the pain, you might want to heat up the joint too.
Sure.
Because you're going to find quite often that, with chronic pain, a lot of times you can get more blood flow to it, and along with the stretch, you actually maybe can really almost knock that pain out.
Sure.
We really like the Thermatex. We've mentioned this many times. It's infrared heat that penetrates much deeper than regular heat.
Right.
Regular heat just goes a few millimeters. This goes up to 60 millimeters, which is
2.36. It's going to get into the joint.
Yeah.
And the muscle. It's going to be a deep heat.
So they have a whole bunch of different types. We'll put the link down below, but they have the platinum model, which you can use, on your hip and your knee, and you can even use it on your ankle. This one was made specifically for feet and ankles. So you can just slip your feet in there. It's called the big shoe or the big foot or something like that. The big slipper, I think it's called.
There you go.
Yeah.
One way or another, it looks like this. It's the only thing they have that looks like this.
Yeah, so you can slide your feet in there, and this will actually, because it goes 2.36 inches on the top and on the bottom, it's going all the way through the joint.
Sure, you're getting a complete heat.
So just wanted to put in a little plug for that, because I really like this for my back, and I use it all the time.
Yep.
It's one you'd have to drag or get from my dead cold hands or whatever they say before I'd give it up.
So this will be good for either stretch on the ankle. Now, if you check your range of motion and it's the same going up, but you notice pointing down, one goes all the way down and this one doesn't, well, then we need to stretch this one. We call it plantar flexion, or in that direction. So you can do it just by your hand and give it some gentle stretching there. If that's not enough and you need a little more pressure, the easiest way to do it, if you can tolerate it, is do what Bob's doing right now.
Yeah, there's a reason I'm getting up on the table and looking like this.
Yeah.
So I'm just kind of gently rocking back on it, so I'm doing pressure on.
So right here's the stretch.
Pressure off.
He's stretching the knees and the hips as well.
Pressure off. Yeah.
This is what we're looking for.
Pressure on.
For this particular joint. Okay.
Let's go to the knees.
The knee. So if you look at the knee, we want full extension, in other words, straight, and fully to bend it so you can pull your foot up like this. This is one way to stretch it. You could do the same thing laying down in your bed. So straightening it out. Bob, why don't you lay down one so we'll just show both ways. If you're in a chair, if this knee goes fully straight and this one doesn't, you can see there's a difference here. There's a height difference. Probably this is the knee that's more painful, and we're going to stretch it like this. Now, in bed, Bob is...
I would probably have it up on something, wouldn't you?
Yeah, you could do that. You're so tall, your foot goes off.
Right.
We got a short pillow. But yeah, you could put a pillow here and see if that knee is straight.
Right.
So you're testing it that way. And then for the bend, just bring your knee to your chest.
Yep, and I'd be working on, I can do pressure on, pressure off like this.
So
pressure
you
on,
can,
pressure off.
to assess one side to the other, you just pull that
Oh,
knee
right.
up.
So I'd pull this up and then I'd compare it to this side.
Right.
And maybe even both together. But you're going to be able to tell by feel even. Like,
Sure.
oh, this one feels really tight.
Yep.
And this one feels really loose.
Right. Right.
So
Again, you can do it seated or laying down. That's a nice thing about this. And like Bob said, we're going to stretch it here. Where you place your hands, down by your ankle or up here, can make a difference too. You're going to do whichever one feels better and gives you more range of motion. 5 to 10 reps of that as well. And then for the straightening one, usually put your hands above the knee, above the kneecap, and pressure on, pressure off. Again, this isn't going to clear in one treatment session. This is going to take days or sometimes weeks.
Investment of time. Mm-hmm. So you could use the knee glide too.
Oh yeah.
Did you mention it, Brad?
Yep, sure. This is one of those things that we really like, just to get your knee. If your knee is a problem, you can get it warmed up by working it back and forth like this. And for stretching it, it's nice because it actually moves and you get more freedom, and it just works out as a nicer stretch. This is also in our favorite products list below the video.
Probably because we invented it. So.
Right. But it works well.
It does work well.
I mean, that's why we made it. Cause
yeah. There's nothing else on the market.
Right. We needed something to make that work. Now, should we do the hip?
Let's go to the hip. And one thing about the hip is you can check the hip flexion just like you did with the knee flexion.
Yep.
You can go ahead and pull it up like this.
So that's this right here.
Yeah, that's bending the hip. If I pull this one up and this one goes all the way, and I pull this one up and it only goes this far, you know that you have a tight hip into the hip flexion, and you're going to want to work on that direction then. Again, really amazing. I've found, Brad, with a lot of patients that just by little improvements, a lot of times the pain starts to go down. It really is shocking to sometimes.
So this is interesting. The way to stretch the hip is the same way to do the knee. Now, if you want to focus on the hip and not the knee, don't grab over the top of the knee. Grab here, right below the knee on the hamstrings, and then your knee is not getting involved and you're focusing more on that hip joint. And then
I was just going to show, Brad, that sometimes people, if they have trouble.
Oh, sure.
If you're a little short on arms and you can't reach down to the legs, you can put a sheet like this and pull it up like this. You can also do the knee by pulling up like this here. So just take
it is very common that people have a hard time reaching around.
Quite often I've seen that. So
why don't you lay down, Bob, and we'll show a hip stretch off the edge of the bed.
This one you're talking about?
Yep, there you go. And this is a nice way, just right in bed, you can leave that one hip go off.
And then you pull up on this one, and then you're stretching this one. I really stretch this a lot, so you can see it's coming down. For someone who's tight, it's going to be sitting up like this.
Right, and you can use a towel roll or whatever to hold this if you can't grab it.
Right.
Just relax and let gravity work. I think this is probably one of the best ways to do it.
Yep, let
it's
gravity
a lot
do the
easier
job.
doing the knee on the floor, so we're not even going to go there, Bob.
Sounds good. I agree. Yeah.
You concur?
I concur
Another
again.
concurrence.
All right. Hip external rotation. I like this one, Brad, because it's very easy to do.
And it's number 7.
And it's number 7.
It makes it complete.
So again, what you're gonna do is you're gonna put your ankle up on your knee, opposite knee, and I want you to see how high that knee is up compared to, do the one side, then you do the opposite side. This one's tighter on me, so this is what I'm gonna work on. Very easy to do.
Right.
You can just go ahead, pressure on, pressure off. I had one lady she had chronic pain. She was to the point where she couldn't even walk anymore. Not that very old. She was only in her 50s. When you're in your 50s, you got to say that.
Right.
And she did this one exercise, and it took away her pain. Took it away. Not made it better. Took it away.
Abolished it.
Yeah, that's right.
So I just had a 74-year-old woman yesterday I was working with. One thing I want to precaution, if you've had a hip replacement.
Yeah, you don't be doing this.
Then you don't do this. And that's what she had. She had one that was replaced, and it was very tight, and I talked to her about it. She says, I had this replaced 10 years ago. I said, well, we'll just skip it on that leg. So she did the other leg, but she was able to do some of the other stretches.
Sure.
So, yeah, caution if you have replacements on these joints. Be very cautious. If there's any pain at all, then you're not going to do it.
Well, the knee joint, you could go ahead and do those stretches. I'm pretty
well,
sure.
That's true. That's true.
And you don't see ankle replacements very often. But okay, we're way over time, so.
Oh, sorry about that.
Thanks for watching.